Amid races to find a vaccine to prevent COVID-19 infections, health officials in the UK are concerned that it's not just the virus that is spreading, but so too is misinformation. A recent YouGov survey found 1 in 6 British people would refuse a coronavirus vaccine if offered, with a further 1/6 saying they weren't sure whether they would accept one. The poll was commissioned by the Centre for Countering Digital Hate.
The best predictor of whether or not someone was vaccine hesitant was whether they got their information from social media rather than traditional media. And why is that? Because misinformation flows unabated on social media platforms. Worse still, we found that the algorithms promote divisive content. The NHS and other public health bodies are finding themselves fighting a losing battle against content that's salacious, exciting, but ultimately very dangerous.
For frontline medical workers, distrust of vaccines is not a new phenomenon, but doctors say it's becoming increasingly common for them to have to educate patients about the dangers of using the internet for health advice.
Vaccine hesitancy is an issue that we've had for a long time now, and I think it started particularly around the MMR scandal, which has been disproved widely over and over again. But people are understandably anxious about injecting themselves or their children with something. Now, when it comes to something like the coronavirus vaccine, first of all, the trial which is at the forefront, the Oxford trial, is using technology that we have known about for a good while.
As for the spread of anti-vaccination mistruths, doctors say they consistently see a level of subtle sophistication in the methods that are used to spread misinformation to vulnerable patients.
So they've taken a grain of truth, which is why it feels true, and then they've run with it and they've made something which is not correct. I would always say get your information from somewhere like the NHS website, or do ask your GP so that you know that what you're getting is correct, and then you make your choices.
The World Health Organization is hopeful a vaccine could help prevent people from becoming infected. But until one is found, the best defence against the disease remains social distancing, mask wearing and frequent hand washing. Trent Murray, Euronews, London.